Good afternoon and welcome to the Flint Community Webinar, your community resource every Friday at noon. I hope you're doing well. We had some pretty wild storms here in Michigan, so hopefully you didn't lose electricity. Hopefully everyone stayed safe. But we're so glad that you were still able to join us this week. We have an amazing line. We say that every week and every week it's true. We have an amazing lineup for you this Friday. I'm Heatherlyn Uphold. I'm an assistant professor here at Michigan State University, filling in for Dr. EJ, who is dealing with some power outages, taking care of patients, doing all of the wonderful things that she does. But I want to introduce our speakers this week. We're going to hear from Dr. Jay Gottschalk, and he's going to talk to us about calls to compassion. We're also going to get an update from Dr. Harold Steinman, who's an optometrist, about primary health care and the work that he's doing in the community, as well as an update from our friends at the Healthy Flint Research Coordinating Center. They've got some events coming up, lots of stuff going on in the community this weekend, next weekend, whatnot. And we want to make sure that you're in the know and aware so that you can pick and choose where you head to and get that information. So I'm going to transition to invite Dr. J to join us. And before we get started, what I'd like to do is, I was kind of looking at your background. Can you just tell us about yourself a little bit and the work that you do in the College of Nursing?
Sure. So I wear many hats, not least of reasons because my head gets cold due to a lack of hair. I do a lot of my work in terms of, I teach undergraduate nurses behavioral health from a framework of not only helping them understand the mental health needs of patients, but also their own individual mental wellness needs and finding ways to navigate the mental wellness of the spaces in which we all find ourselves. So traditionally, nursing, and I feel other health professions have very much taken the line of, this is our calling, suck it up, buttercup. This is hard work and we just need to persevere. And what your needs are very secondary to the needs of the rest of the world. And what there are some truths that we face, and not the least of which is that we know that mental health issues were prevalent before the global pandemic. I mean, we saw mental health struggles were true for at least a quarter of the larger population. At the height of the pandemic, those were closer to 30–40%. But then in clinicians, we saw well north of 50–60%, and rates of not just things that we think of like depression and anxiety, but post-traumatic stress skyrocketed during that period of time. And so helping clinicians be mindful of the needs to address their own mental wellness has always been important, but became even more important. But also becoming more aware of the fact that we talk an awful lot in leadership places, in education, about teaching skills for mental wellness and resiliency to frontline staff without having those harder conversations of, how do we make it so that the place in which you function builds your resiliency, shields you, and helps bolster your resiliency? So there are two worlds of resiliency. There's the individual, and you can have a fairly strong sense of resiliency and personal agency, but if the place in which you function continues to shut that down and put you into a place where you feel that you are ethically and morally challenged, after a while, that erodes. So only the people who have that extra gene switched on that makes it so that they are positive regardless of what is happening with them, then that resilience is just going to crumble and erode over time. And you will end up experiencing burnout. You'll experience secondary traumatic stress, things of that nature. So the research that I have done is, how do we create workplaces and leadership that create places in which it is healthy for you to be? Because we'll often challenge healthcare leaders to create these environments for their frontline staff without saying, but who's supporting that leader? I knew many places over the course of these last 3 years where the leaders would churn through. So frontline staff would have had 4, 5, 6 different leaders in the course of a year. So there was no stability. So even if you loved the work that you did, you would have no sense of, hey, there is a person here who I know is making sure that that's touching base with me, making sure that I am okay. It's, kind of in a sense, it's who watches the watcher, but who shows compassion for the leader that is supposed to show compassion for the frontline staff? How do we build those environments in which resiliency can flourish and grow instead of erode over time? That's part of the work that I do. The other work that I do is I actively work with patients at both MSU and at Cristo Rey, which is a family health center here in Lansing. Yeah. So I work with a variety of people, from people that are getting free care all the way up to people who have private insurance. So kind of the whole spectrum. People who are refugees, people that are fellow faculty. It gives me a nice cross section of the population, and so I also then get nice pockets of how are all these different people navigating those sorts of things, and what are the stressors in people's communities and environments that are playing a part in their mental wellness. So again, kind of getting back to that idea of maybe not the place where you work, but how does your neighborhood support your mental health and your resiliency? How do we create places in which we feel that we're accountable and watching out for one another, versus places where you don't know your neighbor and you have very little incentive to get to know them and you don't feel safe in those spaces? So kind of trying to take that more holistic outlook and kind of a social determinants perspective of mental health and resiliency. So that's kind of my background. I come to this position kind of through a little bit of a random walk, probably not least of which is slightly unbridled ADHD. So I mean, my personal journey started out in the world of business, and I saw the financial crisis of 2008, 2009, and how that really kind of shattered people's sense of stability and mental wellness. And at the time, I was also volunteering at a local hospital, working with oncology patients, and seeing how in that very challenging space, patients, their family and friends and the care providers there were all kind of dealing with those situations as well. And really kind of the themes that kept coming back to me were, how do people navigate these things? And when they're faced with these challenges, how do they overcome and persevere? And so kind of through that, I found my way into nursing at the University of Illinois at Chicago, got my bachelor's degree, then came back here to Michigan, worked in the space of oncology, hospice, and palliative care, where again, I saw a lot of frontline people and a lot of patients struggling with, kind of their own internal struggles, familial struggles, and again, seeing those challenges that led people to their hearts and minds to stray from those places where, hey, here's my best self, and I feel that I am not there. And is it and a lot of people, because we are a nation of individualists, a lot of people like to take that as in our individual accountability, and I have failed in some way, shape, or form. And again, exploring, were those spaces that they were in, how were those spaces supporting those people's wellness? And not infrequently, they were not. Mm-hmm. And so that kind of led me then to get my master's at Michigan State in nursing, where I then was kind of as a clinical nurse specialist, where they spend a lot of time looking at ways to improve the quality of care and kind of the systems of care. And so I could kind of apply my knowledge not only of the business world I'd been in, but also ways to create more supportive frameworks for staff. And then I worked, I circled around Lake Michigan again, this time to Milwaukee, where I worked in oncology for another 5 years, and started working as a psychiatric nurse practitioner, and got my doctorate, where I did my started my studies in leadership and ways of leadership improving mental wellness in those spaces of mental wellness. And now I'm back here. So I've been with Michigan State now for a year and a half, and kind of at the height of the pandemic and seeing a lot of the struggles that people were dealing with, I came up with this idea that I'd like to share with you now of, I came up with what I like to call a commitment to compassion. So first I'll share it with you, and then we'll dive into it a little bit more. But effectively, I, Jay, dedicate myself, and you can insert your name there. You don't need to say Jay unless your name happens to be Jay, in which case, hey, good name. I, Jay, dedicate myself to keeping an open heart, an open mind in my interactions with others. I will assume that others have positive intentions behind their actions, and I will avoid telling myself stories that assume the worst about why someone behaved in a particular way. I recognize that by being a source of compassion for others, I'm helping to reduce not only the physical suffering of the people around me, but their emotional suffering as well. By being the source of compassion, it is my sincere wish that I'm helping others to spread compassion to the people they interact with throughout the day. Most of all, I promise to be compassionate with myself and recognize that I'm a human being who will make mistakes. I will make mistakes, and that is okay. I will do my best to learn from those mistakes and use them as opportunities for growth in both my personal and professional life. Now, why did I come up with those words? Am I channeling my internal Mr. Rogers? Well, maybe in some sense, yes. But also, there's this idea that I think we fail to appreciate in how much the words that we use matter, and the ways in which we have a dialogue with ourselves and with others about our own individual welfare. I found not infrequently during the pandemic and in the aftermath of the events of February here at Michigan State, that people were exceptionally good about being charitable with others and understanding that, hey, we're in a difficult time, and I will give you the benefit of the doubt that you are struggling with something, whether it's the weight of a global pandemic, whether it's the weight of having survived a mass shooting, whatever that is, defaulting to compassionate thinking toward other people. Now, outside of this framework, I think it's a lot of us, if we think about the words that we use in our day-to-day basis, are not always so charitable. So an example that I like is, think about you're driving down the interstate and somebody cuts you off. Now, the words that might float to mind, or the words that come out of your mouth, may be "that jerk." And the words that you've chosen for that person are, they are a jerk. It is not, that's a person who just cut me off. So there's an action they did that you weren't overly fond of, but you've now just turned the entirety of that person into a bad person. And we do the same things with ourselves. So how many times when you sit down and do something and you make a mistake, you flub something up and you go, well, that was stupid, or I'm such an idiot. You're, again, there's a difference there. They're both not positive self-talk. But if you say, I'm an idiot, again, you are putting that out there, that you are somehow lesser than, that you are not deserving of that kind of charitable thinking. And again, most of us tend to default to more charitable thinking for others than we do for ourselves. Our personal self-talk usually is not overly forgiving of mistakes. We are usually quite critical of ourselves. And so there are these ideas that we go around with where we will use an awful lot of language that is critical, hyper self-critical, not infrequently critical of other, and we don't even necessarily think about the words that we're using, and it doesn't. And people can use these words in everyday language, and we don't necessarily go, oh, that person's, they're a very negative person, or they're a very anxious person. We just kind of think, oh, well, we would all have called a person in that situation a jerk. Many of us would have said, oh, that was a stupid thing to do. Instead of saying, hey, that person who cut me off, who knows? They may have had an emergency and they needed to go to the emergency room, and I don't know. I'm not in the car with them. I lack telepathic skill. If you have that skill, good for you. I do not happen to possess that. And two, the expectation that we're going to get it right every time. Being a human, that we have to practice our humanity. We don't have a perfection of humanity. At least I have yet to meet anybody that's got it down pat. So to that end, the commitment to compassion is challenging us to change the words that we use. And I use this as a tool with my students. I not infrequently use it with my patients. And we read this aloud together because, again, words matter. And especially if we say them out loud, because if you read the words on this page, the visual part of your brain lights up. Most of us on some level are, whether we appreciate it or not, giving form to those words as if we were speaking them. So there is some muscle memory engagement, but by saying them out loud, we are both activating the auditory centers of our brain. We are, if we're reading it, we're also activating the visual centers. But in the act of reading it aloud too, especially with somebody else, we create this accountability. Because if I say something out loud to you, you've now heard me say those words. And those words now are, well, I just heard Jay say that he was going to think more charitably about other people. He was going to think more charitably about himself. So if I hear him say something critical about another person, if I hear him say something that is self-critical, I now feel more charged to say, hey, Jay, you just said that you weren't going to do that, or you're going to try to be better about doing that. Do you not value the words that you say? And most of us, not wanting to be hypocrites, would say, no, I did say those words. You're absolutely right. And I should value those words that I have said and shared. So there is very much a value to saying them out loud. And even if it's saying them to yourself, because we too have a level of personal accountability, and some of us need to be better challenged to accept that accountability, but we all on some level hold ourselves accountable. And in the case of being hypercritical, hyper personal critical, we are holding ourselves accountable for things that are outside of our charge. So another part of the commitment to compassion, kind of expanding that, is I like to think on the words of the Serenity Prayer. And people go, well, Jay, that's only got a specific target. And I would like to counter that and say, no, those words are over 2,000 years old. They were not created specifically for people that were dealing with substance abuse. The idea of temperance is temperance in our overall actions and behaviors. It is showing a way to practice overall moderation, and that is moderation of the way that we are in the world, the ways that we choose to interact with each other, the ways we choose to interact with ourselves. And part of that idea is not thinking that we have control, neither that we have control over everything, nor that we have control over nothing, but understanding that in the middle, we have ultimate control over ourselves and the way that we react to things. And by that reaction, we can choose that when somebody does something to us, We can't say if somebody hits me that didn't hurt, but we can say, we can have a different conversation about what story are we telling ourselves about what that person did, so that our reaction changes based on the narratives we tell ourselves about what people do and why they do it. So thinking very much about our ability to control how we perceive what's happening to us, and using that in more helpful ways. And then also being very conscious of what are the things in my environment over which I have truly control. I have the ability to have a say in the narratives that I'm telling myself about what is happening to me. I do get a say in what that is. Now, if you're struggling with your mental health, that may be less true than it is for other people, but broadly speaking, we have say. We also have the ability to influence others. And that may be more true. Like if you're a parent, you have more of ability to influence, say, your child, but you don't ultimately get to decide their actions, because they are ultimately a separate being from you, and they will kind of do their own thing. Now you can try to ground them, whatever, but ultimately they will decide what they will do. And the same thing is true of the people around you at large. You may be somebody's boss, you may be somebody's friend, whatever, and you have the ability to influence them, but ultimately people get to make their minds up for themselves. So appreciating over those things over which we ultimately have control, and not giving ourselves extra accountability for those things over which we ultimately don't have control. We can say to ourselves, I put my best effort forward to try to influence them in a way that I felt was beneficial and good, but ultimately they are accountable for what they do with that information. And we are accountable for the way that we behave in response to that. So taking a little bit of time to that end, what are some responses that we can be more mindful of? So if we tell ourselves a narrative, for example, that gives rise to very strong anger, for example, are we usually our best selves when we go down the path of being angry? How do we use anger? And so part of this is, you're going to feel like, all right, I feel that Jay's just opened up a notebook and is doing my psych eval right now, and and let's be fair, we all can do the kinds of self-therapy on ourselves that you don't require me charging an hourly rate for anything or submitting anything to insurance. We can ask ourselves when emotions arise that are particularly challenging, how is this emotion helpful? If strong anger arises in us, is that anger because somebody has done us an injustice? And if so, is us reacting in a strong, angry way a helpful way to address the injustice that was done to us? Generally not, because generally when we're angry, we're not using the rational part of our brain. We're using a very emotionally charged fight, flight, or freeze part of our brain. So in those moments, there's a little tool I'd like to offer you, again, for the price of admission, having to look at the glare off my head, being that there's a framework called the Halt framework. And when a particularly challenging emotion arises in us, I would ask you to ask yourselves 4 fairly quick questions. All right, I'm feeling emotionally challenged. I'm either I feel very strongly about something. I want to immediately blurt something out. Am I hungry? Am I angry? Am I feeling lonely? Am I tired? As a parent, I can readily tell you that I'm often hungry and tired. So I know in many of my interactions, I've checked 2 boxes right off the bat. So that framework, hungry, angry, lonely, tired, is a HALT framework. Very apropos. HALT. When you're feeling a very challenging emotion, HALT. Run that very quick checklist and say, okay, I think at least one of those is true. I'm going to take a beat, try to address that thing so that I can come back to this challenging emotion in a helpful way. Now, is that always something that we're going to be able to do? No. But many times, if you're having a conversation with your spouse, your child, a friend, a coworker, and you have those emotions arise, 9 times out of 10, that thing does not require your immediate response and a knee-jerk evaluation of what happened. So I encourage you to run the checklist, ask yourself what story that you're telling yourself about what gave rise to that emotion, and then come back and have a meaningful conversation once you've gone through that mini dialogue. In the time I have remaining, I would like to say, so we've talked about kind of evaluating our emotions, taking these moments of mindfulness. How do we process the information in a meaningful way so that what we've taken in, whether it's this speaker talking to you about concepts of compassion, or you've just read something, or you've watched something, how do you meaningfully process this in a way that you can take it and absorb it and adapt it into your life? So to that end, I think we all need some sort of mindfulness practice, because in our day-to-day lives, we have so many things that demand our attention. And so the 2 spaces in which your brain processes things and puts it away for a useful recall are sleep, which we often steal from ourselves because we find other things in our lives we feel are somehow more important than sleep, which is regrettable because sleep is foundational to physical and mental wellness, as well as this consolidation and better recall of information. 2 is our default mode. And the default mode occurs in a period that we try to avoid like the plague these days, and that is boredom. When is the last time you can honestly tell yourself that you were bored? When's the last time you let yourself stand in line at the checkout counter and not look at your phone? When's the last time when you were riding along in a car, you didn't have something to stimulate you? By choosing this constant stimulation, instead of letting our minds wander and go to these places that we used to have prior to instant on-demand everything, we would daydream. Our minds would wander, they would go, and we'd be processing these things, and we would have that mental space to process and churn through these things. And that in that space is called the default mode, where our brains kind of, while we're consciously, while we're still conscious, is doing that mental processing and working through the information that we've collected at that point. By instead jumping from thing to thing to thing to thing to thing, we don't allow ourselves that space. And so that processing, we're now saying, okay, well, the only space that's now going to happen is when I sleep, and I'm already stealing from my sleep, so there's even less ability for that processing and meaningful working through of information to happen. So ways in which we can reclaim some of that default mode and take some time to actually process and churn through the things are a couple different ways. So one, it's something that I personally do. I encourage pretty much anybody to do. I very regularly ask my patients to do, is to journal. Because there's something about putting pen to paper, pencil to paper, or even if you feel more inclined to do so, typing a note in on your phone in a memo app. You are forced to put down your thoughts onto some place where you can actually see what those thoughts are and think through that. And like putting down on paper, like right now I'm feeling very, very frustrated and I'm writing that down. It's like, oh, that frustration is coming from a place where I'm afraid of the way that people will feel about me based on what's happening there. So underneath that frustration, the emotion there was actually fear, and I didn't appreciate that that was there. Or in this moment of feeling really, really sad, I appreciate that, oh, I realized that I haven't been going out and socializing as much. And I was feeling actually quite alone there in that moment. And so taking the time to sort through our feelings in that space, and journaling can be a very effective way to do that. Journaling can also be an effective way when we talk about ways to hold ourselves accountable for being compassionate. We can challenge ourselves at the beginning of the day and say, today I challenge myself to be kinder with the narratives that I tell about other people. And then at the end of the day, journaling on, based on that challenge, here's how I feel that I achieved that goal. Here's some ways that I feel that I could have been more successful, and what I will do tomorrow and going forward to help myself be more successful in that goal. So journaling, one of two ways. The second way is meditation. And I'm not asking you to climb up on a mountain, shave your head, even though, you know, for some people the look works. But I am asking you to take that time, whether you find that you are a person who likes to take a long walk, whether you like to sit on a bench in the woods, whether you like to just put in your headphones and just listening to some calming music while your mind wanders. Whatever your gateway to kind of this mindful place where you can just kind of let your thoughts just kind of drift past without you locking onto anything, that lets the mind get to a default mode, kind of helps us calm without having to latch on to all the thoughts as they go past, and just kind of let things be. There's this myth of mindfulness that it requires that you clear your head of things, and that's not the goal. The goal really is to become less possessive of those thoughts that go through your head. So instead of a thought comes into the head and we grab onto it for dear life and try to figure out what's behind it, we just let it go. And it becomes a beneficial practice not only for letting our brain kind of just churn through these things and let them flow through and process, but also becomes a helpful thing to take outside of the context of meditation, and make it so that when an anxious thought, for example, comes into our head, we don't feel the need to latch onto it, or anger. We become much better about kind of acknowledging that there is this feeling there or this thought, but being better about letting it go, instead of feeling this possession or a need to or need to dig in to it. So combining these two practices, journaling and meditation is about helping us get to the default mode and become less possessive and latching on to ideas. And journaling, allowing us those times of concentrated effort to kind of dig through things that maybe we need to dig a little bit more into. But then also knowing throughout the rest of the day, hey, I don't need to hold on to those things because I can think through them during journaling, and they'll come to me when I'm journaling. I don't need to hold on to them through the rest of the day. So your journal can hold on to your thoughts for you, and you can think through them there without needing to have your brain hold on to the baggage of all of that. So again, I'd like to leave you with the ideas of, let's be more mindful of the stories that we tell ourselves about each other and ourselves as well, and try to be charitable in those narratives, and as trying to assume the best about why someone behaved in a particular way. We're not always going to agree with why somebody did, even in our most charitable versions of what we tell ourselves, but at least starting from a place of charitable thinking. From there, considering the ways in which we can help create places where people are more compassionate to one another, because I do feel that by you being in a place where you are more charitable and compassionate with others, instead of lashing out at somebody who you feel might not have done the most kind, thoughtful thing, and then you're essentially passing on your anger or frustration to that other person for them to carry, and they'll carry to the next person, to the next person, to the next person. You're stopping it there. That whatever that emotion was that came to you, you took it, you let it disperse, and it died there. And now you're not carrying it around for the rest of the day, and the other person is not carrying around your retaliation to person to person to person throughout the rest of the day. And in addition to that, finding a way to have a reflective practice of some kind. Again, whether you choose to have that be journaling, whether you choose to have that be some sort of reflective meditative practice, having something that allows you to get your brain into that default mode. And whether that's on your commute to work, not listening to music or a podcast and just being there driving, on your, whether you're sitting down to lunch, just letting yourself eat lunch, taking those times to be genuinely present. If you're there with your spouse or your kids or whatever, putting your phone, your watch, whatever, on airplane mode and saying, I am here and I don't need to have my email, Facebook, text, whatever, vying for my attention. I am present with you. Because the greatest gift we can give one another is time. Whether we take something off somebody else's plate so that they have more time back in the day, or we can give people time by saying, I am present. I'm not other places. I am here genuinely with you, and not having other people steal bits of my time that I'm giving to you away. So thank you for the privilege of giving you these time. I like to plant these seeds where I can. I encourage you to share the seeds and water them where you can throughout your day as you go forward.
Dr. J, that was amazing. It's like you saw into my soul. So much of like notes that just struck so many chords. Thank you so much. I did have I want to be mindful of our time, but why do we find ourselves so often possessive of those thoughts?
I think it gets down to that fundamental part of they're mine, so therefore they're important. And so if my brain has taken the time to bring it to my attention, clearly I need to go after that thing. So instead of it just being, it's something there. So for example, we'll often have distressing thoughts. Like sometimes we will have a thought of potentially doing harm to somebody, like that person really ticked me off, and having a visual of doing something that is so out of character for you to that person. And so your brain now latches onto that and you go, oh my God, am I this horrible person? And the answer is no. The brain put that thought out there, but you don't need to own that thought. That thought came to you. Your brain is churning through all the things that it churns through, and that was a thought that flitted through there. Now, you might go, but I'm not that person. And at the end of the day, fundamentally, we are the people we choose to be through the actions we choose to take. Our thoughts are going to come and be, and we're going to think a variety of different things in the course of our day. But it is those ideas that you choose to act upon that are the person you fundamentally are.
Oh my goodness, we want you back. We want you back, please. But, and what you shared fits so nicely in along the lines of what some of our other partners have shared, from Genesee Health Systems and Lisa Bruder and our CRIM partners talking about mindfulness. And what I think would be an amazing idea is to invite all of you back so that we can have this collective conversation about how do we really change our organization so that they're more supportive of the individual, but then also practice this commitment to compassion within ourselves and amongst our friends. If you wouldn't mind, please share the commitment with us so that we can share it with our viewers, because we want to make sure that that's available. But please find us another Friday. We want to have you back. But I also want to make sure that we get to our next speaker, who is Dr. Harold Steinman. He is doing some amazing things in the community around eye health. And I want to talk a little bit about this. So Dr. Steinman, can you give us some kind of just rule of thumb? What do we need to be mindful of around eye health? What are some things that we need to think about? What should we know?
Okay. Well, let me give you some history of where I am. I was born and raised in Flint, so I'm very, very familiar with the community. And I also grew up with a couple of good examples. My mother was a nurse. My mother-in-law was a physician in town. In fact, she might have been the first woman intern in the city of Flint. She came from Milwaukee, and when she got her internship at Hurley, they were not prepared for a woman to reside at Hurley, so they converted a broom closet into her room, and so that's where she. That was her room at Hurley, and so the women physicians today in the city of Flint can say thank you to Dr. Evelyn Golden, who was the one. She was involved in so many things as well, and then my father-in-law is Dr. Maxwell Golden, who was an internist in town, and so anyways, so she was the one who got it started. And also once when she received numerous awards, which she hated. I mean, she said, I need that like a hole in the head. She would always, that would be her favorite response. But anyways, when I was sitting there once while she was receiving an award, I was thinking is that what can I do? I mean, what can I do to help this community? Because I always say that how much money do we need to live on? And which I think is a very important thing, is that I feel that we are here to be able to provide not only our services that we've gone to school for, but to provide the services to people who don't have the ability or the underserved population. And so I started, probably, I don't know, eight years ago or so. I started with a food rescue program, and I've worked with a number of the organizations in Genesee County with providing the wasted food in this community that goes to the various organizations, which then distribute it to the needy individuals. But from that association, I got to meet some very wonderful people, and I got to thinking it'd be great that to be able to, it's like a healthcare desert on the north end of Flint, anything north of the river. There are no eye doctors north of the river. And so I got to talking with Sister Carol Weber, who's with St. Luke's New Life Center on Pasadena and Lawndale, and they had space available. So I was fortunate to number of organizations, number of doctors who provided the equipment, and so I set up a clinic, and the free eye clinic. If the examinations are free, if the glasses are necessary, that's provided. And it goes to at any age, can be youngsters, can be adults, that it's provided. So actually the hardest part of this endeavor has been actually to get the word out there. I mean, I have met with so many organizations, so many churches, the Genesee Health Department, GISD. I've spoken at various churches. I've met with a number of individuals to help me get the word out there. And so we started pre-COVID, and it was getting busier. Then COVID came along. So then after about a year and a half, we restarted it, the clinic, and it was like starting over. And so it's been back in existence for about 2 years now. And the intent obviously is to be able to provide the care for everybody, because first of all, as far as adults go, they can't see, they can't drive, they can't, it's tougher to get employment with youngsters. And this is the thing where I really think really needs to be stressed, is that with youngsters, that we talk about delinquency. And the thing is that children are not born delinquent. They, it's a result of something. And what so often happens is that if a youngster can't read their books, they can't see the board at school, they lose interest and they get bored with their studies very quickly. So as a result, they lose interest in school. They get in with the wrong people, with the wrong friends. And so anyways, what I have been doing is working with the various school districts with GISD, but also I referee high school basketball, soccer, and volleyball. And when I'm ever at any of these schools, I always have my information with me on my flyers to give to the school districts to get the word out there and make it known that it's available. So that and that helps as well. But anyways, getting back to it is that it's so important with children is that it's been proven time and time again is that if the child cannot function well in the classroom, then they lose the interest, and as a result, it affects their studies. So that's the thing where I say it's so vital to be able to provide these services, and it doesn't matter if it's in Grand Blanc or if it's in Flint. It doesn't matter. It happens in all the school districts. And so it's important that we be able to provide the services if it's necessary for the young and the adult population to be able to have this available. So I've spoken, like I said, probably some of you have spoken with or have or with the organizations you're affiliated with, but in addition, something that I've seen that is absolutely necessary, and especially in the what I see in the area which I consider the north of the river, is medical care as well as dental care, which is absolutely necessary. So that's something else that I would like to develop at St. Luke's New Life Center, is to be able to provide medical care and dental care. And so I thought about, that's when Todd Lucas, who I work with on the board at COC, or Greater Holy Temple on North Dort, that he gave me contacts at Michigan State, Evelyn being one, and Jennifer another one, but also to see if there's some way we could get the students at the Michigan State's med school to participate and to see patients at St. Luke's. As I was driving down Court Street one day, I had forgotten, but it refreshed my memory that there is a school of dental hygiene at Mott. So that's going to be another contact I'm going to make, is to see if we can at least get the school of hygiene, dental hygiene, involved with perhaps developing a clinic. And of course, I'll get in touch with the dental society too, to see if there's a way to be able to get the dentists to be able to provide time and their expertise for the community. But I think it's so important that we've got to do something to be able to at least get some time. I'm always asking the various health professionals, if you can give me 1 hour, give me one half day, give me one day a month. I mean, I'll take whatever you can provide, and to be able to give back to the community, because being residents of Genesee County, I think we owe it to the community to give back our professional knowledge and our expertise that we need to be able to provide to people who are in need.
I wholeheartedly agree. I want to make sure that we touch on, when do you offer the eye care services, and how would somebody get connected if they need it themselves or if they want to refer folks?
Okay, right now, as I mentioned, the intent is to expand the clinic. In fact, I got another doctor joined me about a year ago. I happened to meet him at a conference, and so he comes every other Tuesday. Right now, the days that we have office hours are on Tuesdays, and they're by appointments. And there's the phone number. I can always forget the number, so I can. But anyways, the intent is to expand it from one day to a second day. Right now it's Tuesdays, and the intent is probably on a Thursday to be able to have the clinic open it then as well. So so as we get the word out there, and like I said, that's my hope, is to be able to expand this and to give more time, because it's I know there's a need for it. There's no question. And so that's okay. I've got the phone number right here. It's called St. Luke's Eye Clinic. The phone number is 810-234-8677. That's 810-234-8677.
And it's St. Luke's Eye Center.
Right.
Okay, I'm putting it in the chat so that our folks can grab it. There we go.
Okay.
So you just call, you make an appointment, and folks can get their eye exam and glasses.
And glasses are
Amazing.
Yeah, and no cost whatsoever, none. And so what's also what I found has worked out very well is well, one thing that's been very difficult is some people just don't have transportation.
Mm-hmm.
During COVID, MTA had Rides to Wellness. There was no charge for it, but that now there is a charge involved. However, I spoke to a woman involved with one of the organizations in the community, and she says she thinks pretty soon she'll be getting a grant for vehicles to be able to provide rides, and so she will, as soon as she said I'm at the top of her list, that she will get in touch with me once she knows that she has the grant. And so if so, that's a real important thing. But right now I work with many organizations that they provide, to take, like Odyssey House is one. There's I don't know, I'm horrible with remembering names, but anyways, there are a number of Salvation Army. They may have 4 or 5 individuals, and they will bring them all, set up an appointment and bring all the individuals to the appointments. So
that's amazing. This is a wonderful service that not every community has. And definitely something that we want to expand. I'll tell you, looking at who's on the webinar today, buckle up, because these are folks who will send referrals to you and look for ways that we can partner. You know that Dr. EJ and I are already making plans for you for how we can get the med students involved and really meet the needs of our community, whether it's north of the river, like you say, or elsewhere, so that we can give folks, better vision, better dental.
Yes, I really appeal to everyone listening today to please, if you know of people who can use these services, please contact us. And like I said, it's I always say that I don't make a nickel off this, but it's worth $1 million, because believe me, it feels like that. It does. It really feels that. So don't think you're going to overwhelm me, because you will not. So,
all right. You heard the challenge, folks. And if you do, we'll figure out how to get some resources for you. So we don't want you to wear out.
Okay. Well, thank you. That's like it. Another thing too, just one more thing, as I mentioned how important it is to the, especially to the youngsters. We don't want them to fall behind in school. Is like I work with Educare, with the GISD, and it's a thing where I can't tell you how important it is to be able to provide this to the youngsters, especially. But like I said, I see it with the adults where they can't see the end of their nose, and it's been like that for most of their lives. And I see that time and time again, and it's hard to conceptualize that, but there's so many people like that. So like I said, please let me know the people, or we'll get them in for sure.
I love it. We do have one question for you in the Q&A. If there are kids that don't have a typical eye condition, do you refer out, or what happens in a situation like that?
Yeah, that's a great question. The other doctor who joined me is he specializes in pediatrics. Also, what's great is he does speak Spanish too, so it helps. Otherwise, we have Spanish-speaking people come and interpret, but he speaks Spanish, and but anyways, he does pediatric. But yes, as far as if any pathology, one thing like when I had my practice, I had a practice in Davison, and then I retired about 6 years ago. And of course, I treated much of the disease and so on. But I want to be able to see more patients, because sometimes some of the pathologies take time, take like glaucoma or diabetes. So anyways, but so what I do to expedite things, I do work with other doctors who will take referrals. All
right, there you have it. Dr. Steinman, we want you back again, and I'm certain that people will be reaching out. If you have any questions, you can reach out to me at upholdhe@msu.edu, and I'll get you connected to Dr. Steinman, or you can reach out through St. Luke's Eye Center, and you've got that phone number in the chat. We have a couple of announcements, and I want to make sure we get to the. Oh, one thing else,
I'll give my cell phone number if anybody wants to get in touch with me. Let me add that too.
All right.
It's 810-423-8320. So get a more expedited, response, or please let me know, and please contact me.
All right, love it. Thank you so much. I want to make sure we get to our announcements. We've got some events coming up, and we have Nina Lewis from the Healthy Flint Research Coordinating Center Community Corps, who's going to talk to us about an event on September 9th.
Hello, Heather Lynn, and everyone in the Flint community. Thank you so much for having us on. We are so very excited about this back to school health games. The first of its kind, especially from us. We're trying to have a new and fun way to have these health-focused conversations, family style, so young people and adults are hearing the same information at the same time and can discuss together the best route for family care. I personally love and appreciate the energy of competition, and game shows are always fun, and this will work like a live game show. So we're inviting the entire community out to be a part of our studio audience outdoors on September 9th on the grounds of Bountiful Love Church on 3432 Pasadena Avenue. The back lot area is where we'll be set up. This trivia and physical challenges, as you see here. It's kind of like Family Feud meets Family Double Dare. And if you've seen either of those shows and you mash them together, we're going to have an excellent time. Our primary focus is on post-COVID health and wellness with expanded information concerning other major health issues facing Flint and Genesee County. We understand that COVID is still a thing, and thanks to the good work of partnerships in our county specifically, that this webinar was a huge part of, there is no longer a disparity in terms of access to the vaccine. However, we want to continue to ensure that people understand the importance of staying current and staying safe now that the emergency has ended. These physical challenges are going to be a great way for us a great reminder that being active is always a great way to stay on top of our health. These challenges will be an option for contestants who get stumped by the trivia. And we have a retired Navy Chief, James Eichelberger, a Flint native, who will be facilitating those challenges. We're very excited about them. You can go to the website at www.hfrcc.org. Under the partnership projects, you can register for a team there. You can volunteer there. If you're a healthcare professional, you want to volunteer your time and services to be a judge or fact checker, you can do it there. You want to be a vendor, you can do it all there on the website. If you need any more information, you can always reach out to me at Nina Lewis at hfrcc.com. Or you could call me at 810-777-5932 at the office, and we would love to have you, see you there, and be a team. We want our teams to be registered, and it is free for everyone, free for our vendors, free for our teams to come out and have a great time. There will be prizes. There will be a trophy, a giant one for the winner. So we want to make sure that people come out and have a great time. Thank you so much, Heatherlyn.
Awesome. Thanks, Nina. I'm looking forward to that event. It should be fun. Also, keep in mind, there is a huge health screening and health fair tomorrow, Saturday at the Flint Northern High School grounds. It's in conjunction with the class reunion tailgate. There's going to be lots of opportunities for testing, information, games. There's a kid zone. There's just a lot going on. So make sure that you sign up, that you can register. You can check that out on the NMQF, that's the National Minority Quality Forum website, and we'll see you there. Also, make sure that you head to the Teddy Bear Picnic that's coming up in September. And as always, our beloved community health workers, you can get those CEUs once you exit the webinar. And we'll see you all next week. Thanks for joining us.